I have a few questions that I came up with for the interview, and it's just
Okay.
basically asking what you're doing now, what is your profession, and what are some of your responsibilities and stuff like that. So it's pretty easy, right?
Okay.
All right.
Sounds good.
So why don't you tell me a little bit about what your profession is right now?
All right. So right now, currently, I'm a registered nurse and a registered nurse for Children's Hospital of Los Angeles.
Nice.
And I also I passed my boards too. So I'm, they call it CPON. I'm a certified pediatric hematology oncology nurse.
Nice.
So basically, I specialize with cancer kids and any type of like blood disorders.
Oh, wow. Nice.
Yeah. So our specialty on the unit that I'm on, it's hematology oncology. So it's basically either leukemia kids, any type of cancer, or blood disorders like sickle cell, like anemia, all kinds of different blood disorders that someone can have.
Oh, cool. That's interesting. So when you were like an undergrad, right, and you were like deciding which path to go in, what was your main reason to like go into this path?
So it's funny because as a little kid, I would always want to play doctor and nurse with my siblings. And I always would say, I want to be a doctor when I grow up. I want to be a doctor when I grow up. And as I got older and as I went to school, it just kept in my head that I wanted to proceed and be a nurse. So what I did first, after college, I went to just like Bryman College, just to do like a medical assisting program to see if I would like it.
Yeah.
So I actually did medical assisting for 10 years. And then after that, I was like, you know what? I think it's time for me to proceed. So then that's when I went back to college and I started doing all my prerequisites and to proceed my nursing career.
Oh, cool. So you did a medical assistant program first, and then you went back, right? So
yeah. So I worked as a medical assistant. I finished. I graduated as a medical assistant. I worked as a medical assistant for 10 years. And then after, I was like, you know what? I always wanted to be like a doctor nurse. Let me just go back to school and proceed with the nursing career. So then at that point, I went back to school and I did all the classes that were necessary for nursing.
Cool. And did only going to school, was those the only trainings that you needed, or did you need any other trainings besides like classes that you were taking?
There was really no training involved. It was just all classes that you needed to take. Like very specific classes for the nursing program. Once you get accepted into a nursing program, then that's when you follow their curriculum, and then that's when the training and the hospital like visits happen. You have to complete, once you're in nursing, you have to complete a certain amount of hours as like training or like following like a preceptee. And then once you complete your hour, but the hours, it's when you're at that specific nursing school, they place you at different hospitals where you can meet your hours.
Oh, okay. That's cool. I didn't know that,
Yeah.
So you're telling me you work with a whole bunch of patients that work with leukemia or cancer, right? So when you're working with them, what responsibilities are you in charge of?
So as a registered nurse, basically, you're the one doing all the work. The doctors put in like all their orders in the system, and as your day goes on, you're keeping track of all the orders that are going in, and then aside from that, your responsibility is like assessing your patient and continuing to care for your patient and make sure that like they're stable, like their vitals are stable, and that they're not that there's nothing suspicious going on, or that there's nothing else going on that you suspect that is not what should be going on. And then at that point, if you think your patient is not doing well, then that's when we call the doctors and we tell them what's going on. And for the most part, they'll tell you like, okay, do this, do that. I'm going to order another medication. and then they usually come and assess the patient, and then you go from there.
Okay. So, is it easy working with kids? Like I know with adults, you're able to have communication skills with them, but like with kids, is it like harder?
It can be very difficult and very challenging because, of course, the smaller they are, the harder they are to understand.
Yeah.
Especially when you have like newborns or like either like little toddlers that they can't communicate their pain. They can't, all they do is cry. So a lot of times it's just based on like experience and based on your assessment. Like, what a normal cry is, and like, okay, this kid, there's something going on with this kid, A lot of times too, the parents are the good judgments. You ask the parents, and then the parents will be like, no, stop. The parents will, sorry, girl. The parents will be like, you know what? No, I think they're uncomfortable, And then you have the kids that are verbal, which are very good in like telling you what they're feeling. But then you have like, your teenage kids that, attitude-ish, and they don't want to be in the hospital. No one wants to be in the hospital,
Yeah.
Especially when they're sick, and they're diagnosed. A lot of times we get a lot of like depressed kids. And when they're depressed, like they just don't want to do anything. So that can be challenging too, because you're in there trying to give them their medications, but at the same time, like they're just not, it's like they don't even see you, Yeah. But then that's when the hospital has many resources. That's when psychology comes in. As a nurse, you can tell the doctors too, like, I'm with this patient. I feel like they would benefit from like psychology, to come to an assessment. We also have a program that's called, it's like a playroom. So in our unit, we have an actual playroom where we have the kids come at like different hours of the day to distract themselves. And they have like the Wii, they have PlayStations, they have board games, all kinds of games. They do arts and crafts. And then in that playroom is handled by, it's called Child Life. So these Child Life people, they go to school and they're specialized. It's basically like specializing in child development. And then they go through a training course on how to help like these specific kids, how to talk to them. Obviously, if you have a 1-year-old, how are you going to tell a 1-year-old, oh, you have cancer? Like, they're not going to understand, know? So they have like doll figures with, like sometimes most of our kids have like a special centralized line. Instead of them getting poked every time for like blood draws and stuff, it's like a catheter that's implanted that's like more of a permanent line, where now we access that line and we draw blood, we give medications through there. That way they're not feeling like the torture and the pain of getting poked. So then these Child Life specialists come to them, and they have like dolls, depending on their age, where they have these pretend lines. So then they come and they talk to like the whatever 2-year-old, 3-year-old. They're like, oh, look, I'm going to bring you a doll. Basically in very simple words to make them understand. So they do it based on age, whatever is appropriate for them. Then these Child Life specialists come, and they're the ones in charge of talking to the family, like giving them extra support during their hospitalization. So and then they bring games, they bring arts and crafts. Like for Halloween, our hospital gets a lot of donations. So for Halloween, we have donations for like Halloween costumes. We have the kids come, they choose their Halloween costume, and then they play dress up, and then we do like a little trick-or-treat event in our unit for Halloween for them. So we try to do things to make it fun and exciting for them, rather than them just being laid in bed, like closed in a room,
Yeah.
It's harder, especially for little kids.
Yeah, so it's interesting because you guys are teaching them and at the same time motivating them to like stay happy, because at the end of the day they're kids, right? So that's very interesting.
So it can be very challenging.
Yeah.
For teenage years, for teenage kids, and for like the little ones that don't speak,
Yeah, I could imagine. So so I know like these specialists come in, but like As for the parents, do you like motivate them to stay positive?